Thank you for joining us today for our webinar titled COVID-19 Using AI to Optimize Supply Chain. I'd like to begin by introducing our speakers. Vijay Sarashetty. He's a Chief Strategy Officer and co-founder at Arogya.ai. His interests lie in the fourth generation technologies such as big data, AI, IoT. He believes if all of these are applied correctly, the world could be a much better place. Chetan. He's a data scientist at H2O and has a background in software product development and developing AI-based solutions in healthcare, banking, and human capital sectors. James Otten. James is too a data scientist and a solutions engineer at H2O.ai and is based in Melbourne. His varied experience gives him a unique view on all things AI ethics, responsible, interpretable, and fair AutoML. A few logistics before I pass it on to Vijay. Number one, this presentation is being recorded. A copy recording and a slide deck will be sent to you in the next day. Number two, you can send us your questions throughout the session and we'll be very happy to answer them towards the end of the session. Vijay.
Sure. All right. So, thank you, Saurabh, for the introduction and welcome all. Thanks for joining. Thanks for participating in what is going to be a next a very interesting half an hour, 45 minutes, and an hour will go by. And let's start by saying, why do we need to optimize the supply chain? And I believe a lot of you guys who are on this particular call already understand, because of because of COVID, a lot of issues have been in the news. How even modern countries, developed countries like the United States, UK, Germany, all faced a lack of mechanisms, I would say. Of course, the cause and effect, everything affected everybody, but there were no mechanisms at all. And believe it or not, we may think at this particular point and in this particular juncture that we have learned our lesson. Honestly, no, it's not, right? It's still going on. And that's the reason why Arogya.ai is actually using something far more superior, not just to optimize the supply chain, but to go to the root cause of the issue. What is the root cause? Where does it start? It starts with inventory. It starts with order management, and that is where we are focused on. Next slides, please. Next slide. Okay, yeah, it takes a while. Okay, so even though there's a lot of medical supply chain challenges going on, automating the supply chain, right? So so what are we trying to do? We are trying to make this no touch, seamless, and frictionless. And all of this is, as of today, constrained to the starting point, which is hospital, because the speed matters. So as we go down the line, I will tell you how we have simplified, what we mean by automating the supply chain, no touch, seamless, and frictionless, and how it is going to speed up the entire process from consuming to ordering and to becoming efficient. Next slide. So as we can see from this particular slide, and I'll give you guys a little time to digest what is on the screen, but as I talk about it, is risks are evolving. Because the supply chain is no longer constrained to a country, continent, or an area of the globe. It is global. So, and it is all connected. You may think that the paracetamol that you're getting from Roche, Germany, is manufactured in Germany, and it does not have any connections downstream. But the bulk material may be coming from BASF or Bayer, or it could be coming from Sanofi, or it could be coming from China or India. Nobody has any idea as to the entire chain that actually goes into the development of the into paracetamol. So that is just on the manufacturer side. But what about in the entire supply chain as it goes to the supplier side? So there is both sides, both legs of the supply chain are at global risk, and they can be small things, they can be big things, but even the smallest of things can affect the supply chain. Yep. So you have so many of this loss of talent, etc., etc. So we have put here a slide. One of my friends who is in the who is deeply involved in the insurance industry. Thanks to him, provided me these slides. Healthcare supply chain associated risks, right? Data, predictive analytics, and AI will enable pricing such risk. So manufacturing has its problem, transit has problems, arrival to institutions has problems, institution to users have problem, and users themselves have problems, and consumers themselves have problem. And we do not have, and thanks to COVID, we do not have to go far to look at what example I can use here. Just take a look at the vaccine. What the manufacturing requires sub-zero temperatures, and when we mean sub-zero temperatures, some of them are at -70, -40 degrees. Transit is a headache. Arrival to institutions is a headache, because if the temperature, let's say the manufacturer has done everything in his power to keep it at that temperature, in transit everything has been done. Arrival to institution to the user, that is the last leg itself, could cause a problem. So if that, how to get it to room temperature, how can it be administered, all of that. Can we solve all of that? The big question to ask is, can we solve all of it? If any company comes today and tells you, yes, we can solve it, or you can solve it in the next 1-2 years, don't believe them. It's a long journey, and it will take a lot of technologies and a lot of companies, and most importantly, a lot of investors to get on to this particular scenario and say, yes, there is money that can be saved, there is money that can be made, and there is a way to better health and better all of the supply chain. Next slide, please. Yep. So let's take a look at healthcare inventory costs. So as I said in the beginning, we are not focused on the entire supply chain, one thing at a time. So let's focus on the core problem right now. The core problem is, and this is an example, as I'm in Indonesia, I'm giving you an Indonesian example. The total inventory market per year is $6 billion. Not too much, because if you divide it by 250 million, it is only $24 per person. That is, they're consuming medicines or pharmaceutical things which are only $24 per year. And to people in the countries as advanced as Australia, United States, and UK, that is hardly even maybe a week or maybe a month. I don't know, but it's very low. But when you look at it, the overhead is 19% of that value. And where did we get this? This was done from a research company in the through the European Union, and they actually have a very higher number. They state it at 26%. We brought it down to 19%, after doing our own research here in Indonesia. So the overhead is 7%. What is overhead? The overhead of actually doing the mathematics behind it, right? Chetan later on will actually, Chetan and James will demo, what's the math involved behind all of this. So that's the overhead. Asking a simple question as to, what to order, when to order. So 2 questions: what to order, when to order. For each and every drug, for paracetamol, for ibuprofen, for antiseptics, antibiotics, so on and so forth. So that question itself is 7% of the total, getting that answer out. Procurement costs are another 6%. Holding costs. Am I holding too much? Under stock, overstock? Or can I explain why? What is the trend analysis? And the analysis cost, there is another 3%. So software that is currently available can only do queries and do quite a lot of things. But is there a pattern? Is there something that is out there? But we are very realistic with our artificial intelligence platform, and we say, okay, we may not be able to save you 100% of it, but we can at least save you 50% by answering. And now comes the 5 major questions that all inventory healthcare inventory providers ask. What to order, when to order, how much to order, where to order it from, and how much should I pay? 5 basic questions. And if this can be answered mathematically with due cognizance on the pattern, on the consumption pattern, on the demand sensing, on the supply side and the event side that is happening across the world, well, we are good to go. Next slide, please. Right. So, yeah, this is the last slide that we have before I stop talking. So what is Arogya.ai? It's the end goal is to build a reliable, trusted, optimized health commerce platform that adapts to the dynamic nature and demands of the healthcare ecosystem. It is not a one-man show. It's not a one company show. It is not even a one country show, right? So many networks will come together, driven by APIs, driven by latest technology, IoT, and what other things, blockchain, and so on and so forth, all happening in tandem. But as I said, we at Arogya are absolutely reimagining the healthcare supply chain from the root cause, from inventory and order management. So what you're going to see today is how we have taken the inventory and order management, asked the simplest of questions: what to order, when to order, how much to order, where to order, and how much can I pay, or how much should I pay. So starting with that, we are now going to expand on all of the other things down the supply chain. But this is the beginning, and that's where Arogya is. We at this point, I would specifically thank all of the AI engineers, AI scientists from H2O.ai, and who have partnered with us to help us to get this solution going. It's been a very short journey. It's about 7 to 8 months, but I truly believe we have achieved a lot, and that is to say that it was a major feat. We architected it, we designed it, we got into the principles, the foundation principles, and of course the amazing scientists at H2O.ai who helped us to get to this journey very quickly and to our destination even quicker. So that's what Arogya.ai is. After the demo and everything, as Saurabh pointed out, I hand this over to Chetan and James. And once we are done with the demo, and once we get going, we will open it up to questions, and I'll be happy to answer any questions later. Thank you.
Thanks, Vijay. I'd like to take a moment now to cover a few more slides before Chetan will take us through the demo. So, very interesting, this kind of particular use case. When I first heard about the project that we had here with Arogya, extremely excited. This is clearly a great use case for AI. There's lots of data with clear targets. It's a dynamic, evolving environment. So for myself and many of the other data scientists and ML engineers here at H2O, the opportunity to work on a project like this has been a truly rewarding one, which we're grateful to have the opportunity for. And of course, there are many challenges here, and as this slide mentions, at a high level, what are we trying to do? Well, ultimately, it's about building this reliable, trusted, and optimized platform. It sounds very simple, but the complexity behind that is immense. And we'll get into some of that detail as we go on, but clearly within an hour, we're not going to be able to cover everything. So we'll keep it relatively high level for today, and please do ask questions if there are areas specifically of interest for you guys listening in on the webinar. So just 1 second, bear with me. So how are we solving this problem? So we sort of, Vijay took us through very kind of articulately there some of those challenges that we see. And the intention here is that we're going to solve some of those across this workflow. So many things that we can potentially solve here through things like demand and supply side optimization, improved forecasting, driving greater efficiencies, and inventory management solutions. Ultimately, doing things like having less waste, which clearly just on its own has a huge amount of benefit for society. How do we minimize costs and provide really accurate on-time deliveries? I'm sure we've all experienced, as we've mentioned, within the last year, the challenge, particularly in terms of getting goods to different parts of the world, and particularly for us, Chetan and myself, based here in Melbourne, at the end of the world. That's always kind of a challenge and a problem. And ultimately, this solution, what's it really about? Well, many of those things that we've just discussed, but the primary goal here is about increased health and wellness for patients. And the way that we're going to do this, the solution that we bring to the table here at H2O is the H2O AI hybrid cloud. And we won't have much time today to go into a huge amount of detail around the hybrid cloud, but if you are interested, I do suggest either checking out our website or having a look with a number of videos and content on the hybrid cloud specifically. But what it does is brings together all of H2O technology into a single platform to deliver solutions such as this. And we'll unpack some of the detail there kind of as we go along. But imagine that all of these use cases and pieces are being supported by the H2O hybrid cloud in the back end. So thinking about that and just kind of the process flow we're talking about here, obviously there's huge amount of complexity just within the data landscape itself. And we've listed out some of the data sources there, that we could potentially use to solve this problem. There's the obvious things like the hospital systems themselves, the data that's captured within those. But there's also lots of external potential demand sensing variables that we can use. Things like news, social media, event data, weather data, navigation data. The list goes on. Many things, as we've mentioned, in this hugely complex environment that could potentially impact these outcomes that we're trying to drive. And then, from that data, there's a challenge in terms of acquisition, preparation, etc., around that we then can use within our H2O AI kind of AI engine. We've called it here on the screen. And in that picture, it looks like a very simple little box, but as you can imagine, there's a huge amount of complexity here. And we'll talk a little bit about that kind of as we go on as well. But the end result, once we've built these AI solutions in the back end, is to provide a very simple abstraction of this to the end user, be that, in a kind of semi-autonomous or fully autonomous way. And we'll get onto some of the considerations there, but to do, as Vijay mentioned, we need to provide a solution which ultimately answers these fairly simple questions, right? In terms of what we need to order, the quantity and when, with the goal of driving efficiency, reducing costs, and ultimately, as we've mentioned, improving patient outcomes and patient experience. So that's what we're working towards. And we always have to keep that in mind, particularly when we, perhaps internally here at H2O debating different approaches and different mathematical ways that we can solve particular sort of subsets of this problem, to keep in mind the ultimate goal here and the work that we're doing and the benefits that it can potentially provide in the healthcare domain. So just in terms of the complexity, and this is just, again, pretty high level kind of summary, but as you can imagine, just taking kind of a few data sources that we could potentially use within this solution, things like medications, supplies, devices. There's a number of models which we need to build in the back end. So kind of, at a high level, things like forecasting demand, is an obvious one that we need to do. Understanding risks around different suppliers. So they may vary from time to time. We also need to understand that when we're thinking about the question of who we're going to order from. Understanding delivery times and forecasting those also with these, hugely dynamic, volatile, changing environments. Ultimately towards this optimization problem that we are trying to solve, and the complexities within there to get us towards these, the end result, which is to have stock at the optimal level at any given time across, various items that you can imagine that hospitals are potentially holding. All of those need to be appropriately optimized. And how do we do that? Well, I wanted to talk a little bit about kind of H2O and what we bring, here within this solution. Well, there's lots that we can do, and we talk kind of high level about the technology that we bring in terms of hybrid cloud, but there's a lot more to this than just purely technology. What we bring is our experience and our people to partner to build this particular solution. And there's a number of things that we can do within that partnership space. All the way from the AI journey, as Vijay mentioned, we only started 7-8 months ago, and we've taken an accelerated approach to trying to get a solution ready for the market here. So doing that together and understanding each other and the challenges that brings. Bringing the appropriate experts. So here at H2O, we have a global team of expertise that we can leverage. We're very fortunate to be able to access lots of different experts, be it Kaggle grandmasters, competition data scientists, through to ML engineer experts, particularly when we've been using, say, the hybrid cloud. How do we stand that up and integrate properly? We're very fortunate to have that beyond the direct team that works on the solution, the wider H2O team that we can leverage. Also the empathy, and we'll talk more about this as we go on, but really referencing learnings from our other customers is something else that we bring to the table for all customers, but particularly in terms of this solution that we're working on today. Teaching and empowering our customers, which we intend to do in all cases, and bringing that world-class technology that we've talked about in terms of the hybrid cloud, and ultimately working towards the future as well. So we know, the state of AI today, but we're constantly keeping our finger on the pulse and working with our customers to kind of push the boundaries and really be at the forefront of AI and ML technology. And when we talk about those empathies, I wanted to kind of take a step back as well to think about this in terms of what H2O AI can do and does do in this particular solution. Is we have a good amount of experience in healthcare, and we'll talk about that a little bit later on. But also we have learnings from many different sectors and with vast and varied experience across these, and we can leverage that particularly within this solution. And it might be anything from use case specific, so supply chain in other domains, but also different types of modeling approaches that potentially can be applied to this particular use case also. But then as we dig into healthcare specifically, there's many great use cases from around the world that we can leverage for this particular project. Things that we've done around healthcare, like predictive medicine, through to solutions for things like sepsis detection, working all the way through from kind of the model building to the application layer that we'll sort of talk about as we go on. And then very specifically, as we all know, and this is kind of very relevant and timely, is how we work on solving the problems around COVID specifically. So a number of things that we've done there, over the past year, things around predicting hospital staffing requirements. And again, this is a demand sensing problem. There's many learnings there that we can leverage for this particular problem that we're solving with Arovia. Through to things like understanding population risk. So lots of kind of great use cases within the COVID pandemic itself that we can use in this case. And then taking a step back from talking about our experience, I wanted to just talk briefly again about kind of the platform and solution before we hand over to Chetan. So really, what are we doing? What does the hybrid cloud enable us at H2O to do using the kind of the healthcare data to ultimately predict those outcomes that we talked about for supply chain? Well, a number of things, all the way through from the preparation of data, the modeling, explaining those models, building trust within the outcomes that they provide, through to the deployment and the redeployment. As we know, a very dynamic environment. How do we ensure that our models are still performing as we expect and they're retrained on an appropriate schedule? Through to the operationalization, everything around the governance. As you can imagine, this is an important aspect of any healthcare solution. And also this application layer that we've talked about. So that abstraction, that simplicity of the application layer that goes to the potential end user of the solution. And there you can see kind of on the right-hand side, many of the different people who can interact with this. And in this particular case, there's a number of very specific business users that we need to keep in mind as we develop this solution. And just quickly on the architecture before we get to the end of the slides and get into the demo. Really, ultimately, the applications we're going to deliver are things like inventory management. So an application that leverages that AI backend and the tool set within, but provides a solution for inventory management specifically, or order management specifically, with our stakeholders in mind there being people within the hospitals like the inventory manager or the doctor. So ensuring that all of that technology behind the back end is going to ultimately deliver a solution that's useful for those particular end stakeholders. And just finally, some considerations for this solution that we've talked about. So our ultimate goal with this particular project is that we'll move towards a fully autonomous solution in the future, but not today. There's many problems that we need to solve in the interim in terms of making sure the solution is fit for purpose and we build the appropriate trust. So at least in the short term, what we're looking for is a semi-autonomous solution, something that is going to provide a recommendation to an inventory manager, to a doctor, to then understand what decision next needs to be made around these particular questions that we've talked about. with the long-term goal of fully autonomous. But even within a world of fully autonomous, we almost need to maintain this human-in-the-loop approach. So we'll still have a mechanism in place for review of how these models are working and the decisions that they're making within the supply chain domain. And ultimately, we also need to consider responsible AI. We've talked about this briefly, but particularly within this problem and domain, there are a number of areas that are particularly of interest. One is explainability, and as we've mentioned, the trust and robustness in particular, right? So we know this is a very volatile environment and a very difficult environment with a very potentially complex AI layer. How do we ensure that those models are doing what we expect to do today and will continue to do that into the future? So that is one consideration, but also the human-centered approach to machine learning, I think, is particularly interesting in this solution because ultimately there's a human in the loop and a human impacted by these decisions, be that the patient, but also the hospital staff themselves. How do we ensure that this solution is doing what they need it to do and they're able to interact with it in the appropriate ways to ensure that it's delivering the outcomes we expect? So lots to consider and lots that we've been working on in terms of solving these problems in the last kind of 6 to 7 months with the team. So with that in mind, ultimately, what are we doing here? So a very rewarding project, right, in terms of bringing together healthcare, artificial intelligence to ultimately save lives. And it's a big focus for us here at H2O. H2O Health is a key area which we see growing into the future, and we feel very fortunate to be able to partner with Arovia in this in this particular solution that we're delivering. And with that, I'll hand over to Chetan to take us through a demo of the solution itself.
Cool. Thank you, James. Let me share screen. Cool. So I'm assuming everybody can see my screen. Yeah.
Yes.
Oh, cool. Yeah. So we'll jump to the demo, and before we go on there, there's one thing which Vijay keeps mentioning which I really like is, and continuing with what James mentioned, right? It's just a very rewarding experience being on this project, and the legacy that we can potentially leave behind is a more optimized and efficient supply chain. And because in the healthcare space, we could really impact lives of the generations coming forward, right? So in a very positive way. So it's very, very it's very encouraging. It's very thrilling as well, and it's very challenging too. So what I'll demo right now is so this is a couple of year project, right? So we're still it's been like what 6 to 8 months now since we started this project. And what we've got right now is the first version of a bunch of apps. And I'll talk to you about what we have done so far, what's work in progress, and what's coming up, right, in the next few months. So let me, let's look at this briefly, this particular slide. And I think once you understand this, it'll be easy for us to relate how these apps kind of play together. So so we've got 4 main apps, and that's the user interface that we've built using Wave, which is an open source framework to build user interfaces. So we got 2 simulators. One is the demand simulator and supply simulator, and order manager and inventory manager. These are the main apps, right? And so far we've been working with simulator data, and it's only now that we've actually started actively talking to prospects and customers, and as we speak, we're actually signing up with a bunch of customers starting in Indonesia. And so these apps, so this part is all part of the backend Arovia platform. And the way they talk to the backend platform is via an event bus. And so within the backend platform, we've got a bunch of modules, right? So one is how do we process all the data? How do we, a data layer which can interact with different data stores and data formats. Then obviously we have the simulator engine itself, which is a discrete event simulator. I'll talk to you more about that. And then we've got obviously the machine learning components, which is all around model training, model scoring, and so on, right? So the ones in blue is something which we've not completely integrated and completed the work. That's kind of work in progress. I'll talk to you about that towards the end. So now, keeping this in mind, let's jump over to Order Manager, right? So this is the app where the personas that we have in mind is basically two kinds of personas. One is the person who would log into the app and then they have a call to action, right? So that person is the one who would be probably the procurement manager, right? Who would want to know on that day, on that particular week, what is the call to action? What are those three things that person has to do, right? So in here for that person, when the person logs on, it's very clear. It tells us, look, you got 17 items that you need to order worth that much money from 3 different suppliers, right? And you have a high level view of the breakup in terms of your items from an order standpoint, right? So you've got this is already based off simulated data. And what we see here is that from the data we generated so far, which is around 1 year's worth of data, we've seen around 79.84% of goods have been delivered successfully. We've got cancellations around 318 million. We got defective items, which is like close to 500 million, and delayed items again around 313 million. Right now, in the context of supply chain and optimization, so even if we're to bring in a savings of 10%, in terms of, let's say, can we reduce the canceled items with 10%, right? That is a huge amount of money, right? And that is a savings that we could potentially transfer back to the patients, right? So coming here, so this particular table talks about here are the items that need to be ordered, the quantity that needs to be ordered, the supplier that we recommend that you need to order, and the when date. So this data is that we're operating on are on all based of 2020 data, and which is why the data that you see here is 2021, right? The January of 2021. Now let's pick one particular item, right, and then kind of drill down. So let's say we look at albuterol, and then you look at show intelligence. So this tells us that, okay, so we recommend that you procure this particular drug from Abbott, and 70 is the number of boxes or lots. And we're saying Abbott because we think from our models, the risk of sourcing any goods from that particular company is 0.04, while the average risk across all the suppliers that we work with, the average risk is 0.07, right? So you could pick some other, let's say, supplier. For example, here it's Anugrah Pharma, we say it's 0.08. And so this is in some way for the user to understand why are we recommending a certain supplier, right? Why are we recommending Abbott over AstraZeneca, for example? So you could also look at some other drug, and that'll give you information of which supplier you need to go for. And this is a simple graph which tells us the breakup of the deliveries. So it tells us how many of them have been fulfilled, defective, canceled, delayed. So very simple, simplistic to start with. But going forward, we're bringing a lot more attributes and more variables into play. And lastly, yeah, so we have the data itself, which for a number of reasons you could, if you want, you could download the data. If you want to, share it in SCS or an Excel format, and you could pass it on to your other team members who would want to review. So all those things are possible. Now, this is on the order side. Now let's look at the inventory, right? So this is the inventory manager where, the inventory manager would log on and then take stock of the inventory. So here we say, your current inventory view, right? So we see that there's around 55 million worth of items which are understocked. You got 10 million overstock. You got expired items or nearing expiry, which is around 15% of your inventory, and only around 2% of your inventory are around the optimal levels, right? So now this means there's a huge room for growth, room for improvement in terms of ensuring more goods are around the optimal levels, right? So that is something which is a call to action. And here the view is similar compared to what you saw in Order Manager, except that here we tell us it also gives the information of which critical level your drugs belong to.
On this particular screen, right? So for the audience, so this is as is, right? So the day we install it and all the APIs get me the data, this is what it is. So immediately they come to know, what's their understock items, overstock items, expired and optimal level items. The purpose of this, as Chetan mentioned, is to get an high level view of what is happening with your inventory, as opposed to the Order Manager, which was very specifically telling about the orders, how many were delayed, how many were canceled, etc., etc. So now when we got to the inventory part of it, as time goes by, if everything is being, so we are not, as James mentioned as well, we are not automating it right now, but at a later date, when we come to automation, the machine will learn, keep on learning what was perfect, where did it fail, so on and so forth. And within a year or so, and correct me if I'm wrong, guys, but within a year or so, after all of the feedback mechanisms that are coming in, our understock items, overstock items, and expired items should start dropping off, and our optimal level items should be 100%. And right now it is only at 1.72%, and it should go to 100%. That is, in essence, how we are looking at inventory management. And if we can achieve this through machines and machine learning, not through machines, so through machine learning, I think we will have succeeded in our cause and effort. Back to you, Chetan.
Thank you, Vijay. So I think to Vijay's point as well, right? So now it's in a like a semi-auto, it's like AI-assisted way of doing things. But eventually, when the whole thing is automated, for example, here you would see you can choose one or more items and then say order. And when we actually integrate that with your hospital systems or ordering systems, so that workflow can be seamlessly activated, right? So same thing here as well in the inventory. So you could say, click on all these items and then say request. And that's not implemented yet. So now let's look at the intelligence part in the inventory. Maybe let's pick pluripocal. So we got a bunch of KRIs or KPIs around that item, and this tells us the ratio of the inventory sales ratio over a period of time for that particular drug. Now let's look at. There's a lot of information here, but let's focus on just a few specific graphs, right? Now, for example, this one tells us the item name by optimal levels. But what's more interesting would be this graph, which tells us if this is our, how each item in the inventory, how far off is it from the optimal levels. So obviously, this is sorted order, and if you look at the ones on the left, these are the ones which are above optimal levels. And for the inventory manager, that person might want to focus on things are kind of either out of stock or nearing nearing zero, right? So and we have these charts and graphs also for people to kind of explore, do their exploratory analysis as well. And while the insight, so this particular tab is actually meant for taking actions, right? While opposed to trying to understand and distill to the graphs. So let this load.
So as that loads, let me add to what Chetan has shown. So the most fascinating part about all of this is that it is alive and active. So let's say, and I think Chetan will later cover on a what if analysis, but here, if yesterday and in yesterday, so this graph changes dynamically. So if yesterday there were suddenly 100 flu cases and 100 times 300 doses of paracetamol and ibuprofen were suddenly went out, and that shifted it automatically will redo that. But the best part about it is it has pattern analysis. It knows the engine knows whether it was a one-off scenario, whether I should take it into the averaging, and so on and so forth, right? That's where AI comes in. So practically speaking, this is not a select star from where this is equal to this and this is equal to this and the graph was built. No, this is actively dynamically changing as events occur in a day-to-day basis, and the recalculation and redrawing of these graphs are all real time, almost near real time, I would say. Why am I saying this near real time? As I mentioned in the beginning, we are not at that level of sophistication, not even in the United States, not anywhere else, that in a real time, this was consumed, this went out of my stock, this went out of my warehouse, is not available. So because the data and the rates of data that are coming in into our time series is limited, that's the reason why I say that our engine is near real time. But if we start getting real-time data using IoT or using other mechanisms, we will also become real time. So practically speaking, if 300 paracetamol goes there and the graph changes, right? So what I'm trying to say is, if it was at an optimal level, it will now shift to understock. So the moment it's understock, then there will be mechanisms under the hood that will try to fix that understock item. Back to you, Chetan.
Thank you. All right, so this is about the inventory. I think we do have some time, another 5 minutes. So let's quickly take a look at the simulators, and then we can open the floor for questions. So where did it go? Okay, let's start here. Right, so this is the supply side simulator where we use a framework in Python called SymPy to simulate we use that as a descriptive in simulator. And here's where we allow the user to let's go here. Allow the user to pick and choose modules, pick and choose medication supplies, give a few more inputs like the start date, the frequency of the number of simulations, and the frequency, right? So so let's say I'll talk about the concept of modules as well in a bit. Let's say we choose these two modules and we leave these medications as is, supplies also the default values. And right now we're just looking at 4 different suppliers. And then let's leave everything else the same, right? And if let's preview, it tells us what we've chosen so far. And if we run simulate, so what's happening is in the backend, so we send signals or messages, we put it on the messaging queue. And we got listeners in the backend, which takes those inputs and invokes or triggers the whole workflow for simulation. And once you see that, so let's look at the summary. So it tells us, we simulated 4 suppliers. There's a number of orders that we simulated, total amount spent, and a few other details. And here again, this tells us, the supplier with most delayed deliveries has been Abbott, most defective is AstraZeneca. We got the average number of average delivery time in days and a few other metrics here. So yeah, and I'll tell you a little bit about these charts and graphs as well, right? So we got this concept called auto insights, where the intent is to automatically figure out insights, and with also the capability of coming up with these narrations for as descriptions, right? And a little bit verbose as well, so that it becomes easier for users to understand as well. And we also have this, the other reason is so that we could, in the next phase we're working on is actually choose some of these graphs that are of interest, choose narrations of interest, and then push them or publish them into a document, right? Which can be downloaded. So, and then we've got, this tells us, this explains the delivery time for a given substance. And this tells us the supplier analysis. This again, based off these different aspects of supplies, right? The supplier. And then again, this is the data, the raw data that we're working on. Let's quickly look at the demand side. This is definitely of more interest. I think some people from healthcare background, it's definitely worthwhile looking at this framework called Cynthia. It's an open source framework, open source tool, where you could actually, given a couple of inputs such as population size, the modules that you want to simulate, the medication suppliers, consumers, it is very, very rich, very powerful. And so we built this demand set simulator on top of Cynthia. And so you could actually say, you can define the population, you can define all these different other parameters. And I'll just do the default, right? So let's look at this, for example, right? So here we got, for example, COVID-19 as a module. We have different medications and supplies associated with COVID-19. And so we're also using this as a basis to build our what if analysis or scenario modeling tool as well. So the scenario could be, we see a flu outbreak, or we predict a flu outbreak in the next month, or we're going to see, a COVID-19 outbreak in a localized setting within some part of Indonesia, right? So, and we could use this as a mechanism to say, and we think that that part in Indonesia, the population is around 50,000. We could just choose this COVID-19 module and given a bunch of other inputs and then say simulate, right? So, and then we could, let's look at the results. Yeah, so these are standard analytics, pure play analytics. There's not really machine learning output that is showing here, but this tells us the capability of what we can potentially simulate and extend. So this is the summary, but this is really something of more interest in here, right? So you could look at Cynthia generates a whole bunch of files, but we're just looking at 4 different sets of files. One is the patients, the medications, the supplies, and the encounters. So this is about the average healthcare coverage by city. And so this data that you see is actually, by default, it uses Massachusetts data based out of US, and we're actually piggybacking on that. So which is why you see some of the names of the cities and everything is the US based, but this is basically a demo to show the capabilities of the simulator. And similarly, you got information around medications and got supplies and encounters. I won't go through all these in detail. We're running out of time. And
should we jump to questions, do you think, shortly?
Yeah, I think so. Yeah. Sorry. Yeah. So let's jump to questions, and I'll just leave this here.
Cool. That was really good. Thanks, Chetan. And great to see, just for the audience, everything that we're seeing here is built using H2O Wave, which is the application layer in the hybrid cloud that we mentioned previously. So it's great to see all of that capability built there. There's a question in the Q&A, Vijay. I think maybe you wanted to take it. Maybe I can ask it, and then you can start with the answer. So does that sound good? Sure. So Andre has asked the question. You mentioned this is simulated data. In the real world, with real data, how many different organizations will need to pump data in the right format, right time, and right quality? And how do you drive this high quality, given the output is dependent upon this?
Well, thanks, James. A very touchy question, right? So we have a principle. We call this intrinsic data, extrinsic data, and event data. So the intrinsic data, so what we are doing right now is simulating everything based on intrinsic data, is what events are happening from hospitals, registration, from patient registration, what kind of patient registers. So we are linking all of the system to get to the inventory part of it. Absolutely, and we are, that's a very brilliant question. What we are doing is we are trying to create a network of other event sources, other suppliers, and so on and so forth. So the utopic view of the world is when all similar networks will behave likewise, like the internet of the world, the entire supply chain behaves in a very normal packet transfer, ordered, well ordered, frame driven, and so on and so forth. And there are protocols that are followed. So there are no protocols today. So if there is no protocol, there is no way of getting all of this data at the right time, at the right moment. Maybe I can get it within a month, but already things have moved past and things have happened. So, well, to answer your question short and sweet, we are working towards that end goal. Maybe 2 years, maybe 3 years, maybe 5 years, don't know, can't predict the future. But as of now, we are doing good with the data that we can, and that's the reason why we have the simulator, which says, okay, let's see what happens to our inventory if suddenly I get 100 COVID patients tomorrow. That's it. That's the most simplest way to answer the simulator. If I get 100 COVID patients, or the government tells me that you have 1,000 beds and by regulation you have to admit 200 COVID patients, then what's the reason that I cannot handle 200 patients should be available through the simulator? That's where we are calling it a digital twin. So you can add the number of beds, doctors, and so on and so forth at a later date. But today we are just focusing on the inventory part of it. Hope that answers your question.
Thanks, Vijay. Seems like we've got some other questions coming through. Let's have a look. So one of the questions here, anonymous question, can we generate alert to procurement managers from H2O Wave when optimization level drops drastically? Chetan, do you want to have a? Yeah,
I think so. Alerts and notification is a capability that we are considering, and we don't have that built in yet. But absolutely, I think it's very critical for us to implement that capability. Yes, it's possible. Absolutely, it's possible. And so we got one more question there. So I'll read this aloud. In my experience, the 2 issues that often create challenges when adopting AI solutions are integrating them in existing processes and dealing with operational constraints, which requires a lot of interactions with subject matter experts. Any thoughts on how you envisage in dealing with them? So yeah, thanks for that, Deepak. So yeah, these are like practical challenges, right, that we see in the real world when we start working with customers. So I'll let Vijay, feel free to chime in later as well. But dealing with them, I think one is that the different kinds of challenges here, right? One itself is the understanding the process of. So it's basically from a solutioning point of view, I think there is a challenge in for us to be able to integrate with existing systems and workflows. That is a huge challenge. And along with that comes looking at processes that the hospitals follow. But the good thing is that we are engaging with the hospitals at a very, very early stage. And the way they would definitely, influence and shape the way we are actually building a solution. So we're not saying, look, the whole solution is completely built, and let's go try to, implement it and plug it in your systems and on your platform, right? So we're not doing that. And to just for the to address your question again, the way we want to do that is actually to work with them, have early adopters, have innovators who can work with us, and then we kind of build a solution in some sense together, right? So we have the base constructs and the fundamental building blocks that we worked on, but how we want to kind of glue things together, that will depend on how each hospital and our customers would in the process that they follow.
Right.
Vijay,
And to add to that question and to actually add to Chetan's thoughts, is those constraints are never going to go away. So that's the reason why we architected our system in a very different manner. And I have a background of being in information technology for the last 36 years, dealing with massive banks and massive investment banks, you name it, and we have developed systems. One thing that I have learned is anything new, do not put it in the mainstream between your system of records, book of records, and your decision makers. So stand it outside. So the APIs will collect all of the data, and James and Jong, who is not on the call, will tell you that it's all API centric. All of the data comes in, and then we create those data. So our system is also called an augmented decision support system. So it tells you what to do. It's up to you, up to the hospitals to follow it or not to follow it, right? So if they follow it, well and good. Later on, when it comes to automation, again, there will be, automate this drug, automate. So it is all selected. So that's what. So so we absolutely know, and that's a good question, that these constraints are never going to go away. These challenges will always exist 5 years down the line, 10 years down the line, 15 years down the line. So the idea is to strategically build a system, knowing these constraints and not making them as showstoppers.
Yeah, thanks, Vijay. If I can add to that, the answer to that question as well. Really, when we talk about this and domain experts, this is obvious, as Deepak mentioned, this is a common problem across every AI use case that we work on. And that's where, with the H2O hybrid cloud, we hope to help. So if you notice the slide that we had there when we talk about the solution, the intention is to have ways in which every stakeholder can interact with AI in the appropriate way, but make sure that they can interact and be involved in the process. And that's, this use case with Aurobio is a great first test case to see how that actually works. For a use case which is so critical like this one in healthcare supply chain. But really, the intention for us, when you think about the tagline and the things that we talk about in terms of democratizing AI, is you can't do that without making sure stakeholders get the solutions that they need, and that's what we intend to do. But it's definitely something that's front of mind for us always, and particularly in this use case. Cool. Okay, so. We've got a couple of minutes, I think, and a couple of other questions. So, question here, anonymous attendee: what do the values of supplier risk really mean in the dashboard? Jason, yeah, maybe you can take
you go. Okay.
I was just going to, again, really, this is, and this is. You can see that what we're doing here is work in progress, right? So we have a value there. That's currently a statistical value. Now, ultimately, is that something that's going to be useful for end stakeholder? And we have to make sure that it is. Is that useful? Or do we need another layer of abstraction which says, gives us some kind of banding, or in terms of that risk? But again, yeah, it's currently there's a mathematical formula that sits behind that, and it produces a risk score, which you saw on the screen. But do we need to take another layer of abstraction? Well, again, that's a question that we're going to have with our kind of domain experts to make sure that that is ultimately useful in that case. Chetan, was there anything you wanted to add to that?
Yeah, the only other thing is that right now it's a function of if the goods that have been ordered in the past from that particular supplier, this function of how many of them have been delivered successfully, defective, how many have been cancelled, and how many have been delayed, right? So right now that's how we built it. But essentially what it means is that what's the risk of an organization or a hospital ordering goods from that particular supplier? So that in a sense, that's what it means. But the way we want to build it right now is simple, and obviously we'll bring in more factors and attributes going forward.
Yeah.
And what it allows us to do. Yeah, sorry, you go, Vijay.
Yeah, so one of the beauty of why Arogya uses H2O is explainable AI, right? So it explains, once we have put in all of the parameters and everything, it actually tells you that this supplier risk is high because he defaulted in his commitment. So he said, so let me give you a simple example. So when an order was placed and he said that it will be delivered within 5 days and it took 6 days. So humans forget it, but the AI engine will never forget that, right? So the data is printed for it and it's in indelible ink for a lifetime. So it will take up that parameter and say, he has done this in the past 1 year, he has done it 4 times. That is, he has delayed it by 6 days, this thing. So now we are not, so that's his risk, his individual risk. And then on the compute, as Chetan was demonstrating on the screen, on the compute level, there could be various risks, but it selects the one with the lowest risk. That means it's not that it is risk-free, right? That's not the intent. It's not risk-free, that he is the best risk out there. And later on, the ideas, Arogya and H2O, we have so many ideas, and your questions make these ideas even more wanting, right? It's needed, required ideas. So as time goes by, the suppliers themselves will know that this is the risk that has been assigned to them, and they will start behaving properly so that they do have business in the foreseeable future, and then it becomes a very competitive open market wherein it now benefits them to do the right thing. Right, that's my answer. James, you were saying something.
No, that was an awesome answer, Vijay. I can't follow that up. So thank you. That's very good. I think we're at 4 o'clock. SK, should we take some more questions, or should we wrap up?
Yeah, I think we can take one more quick question before we wrap up. I think the conversation is really interesting, and we have Vijay on the call.
There's just one more, right? So do we cover manufacturers, suppliers, and consumers with our AI software?
Well, there's a funny answer for that, right? There's a very funny answer for that. Now that you guys all on this, all the participants, you have seen this, why don't you go and tell everybody that we have seen this, and manufacturers, suppliers, and consumers, get onto Arogya, get onto H2O.ai, buy this particular software so that we can create this massive marketplace, network marketplace quickly in 2021. But that's my funny answer, right? So it all depends upon broadcasting this event and many more events like this to come. And as you guys have already seen it, we have simplified it to the nth level. Even and thanks to Chetan, James, Jong, who have worked relentlessly on this. The platform is very easy, not only just to deploy, even to deliver it, even to deploy it. We have many flavors of it, cloud-based, on-prem, or private cloud, any which way. All you have to do is get the connectors, even the data structures, the features that we need, we have tabulated all of them. All that the hospital has to do is get there, make those things happen, and then they can actually see this dashboard. One thing that I would like to mention here and take this opportunity to say that is in the very near future, I mean, in the next 10, 15 days, or maybe 30 days, we will be hosting a complete Arogya.ai powered by H2O on our website, the App Store, where you can create a login and actually play with some data. You can put in your own hospital data or whatever data you want in the format that we have in the format, and then you can see how it works, what output it gets, and so that you can actually play around with it.
Great. And I think there's one more important question that needs to be answered. Can H2O liaise with an already set up inventory management system like SAP to extract real-time data like purchase requests, material forecasts to provide insights?
Absolutely. Get me a client and we'll do it by tomorrow. Right?
Awesome. With that, I think we'd like to wrap up. If you have any final thoughts quickly in a few seconds, we can do that. Else, I will close. Vijay, Chetan, James.
Thank you.
Thank you, Saurav. Thank you for hosting.
Thank you.
Thanks, SK. Thanks,
Thank you
everyone,
all.
Okay.
for attending.
Great.
Thanks for listening, guys. Cheers.
Thank you to our panelists for taking the time. Thank you to attendees for taking the time. Like mentioned earlier, the slides and a recording will be sent out in the next day. Have a great rest of your day today. Bye.
Thank you.
Bye-bye.
Bye.